I don't feel like myself. I don't feel like myself. Here's all the things that are happening. And I said, so I'm really interested in learning more about hormone replacement therapy. And you would have thought I just asked her for an illegal substance. Welcome to MENO with Jacqueline Buckingham, the authority on menopause, peri-menopause, and wherever you are on the pause spectrum. I'm Jacqueline Buckingham, founder of MENO, and firm believer that menopause is status, not a sentence. If you're here, something in your body or your life is asking for your attention, and you're not meant to navigate that alone. In our first 2 seasons, we started this conversation, won an Anthem Award, and brought you the leading experts before they were on Oprah. Now we're raising the standard. Each week, I bring you the verified providers, menopause specialists, and authorities you need to understand what's happening in your body and what to do next. From the gold standard in HRT and the little pink pill for sexual desire, to the conversations no one else is having about relationships, identity, and mental health. This is the full picture of your health, because this stage of your life is not just about symptoms. This is about how you live, how you feel, and how to embrace it all, because you have arrived. Pausing or not, start here. This is MENO with Jacqueline Buckingham. Dr. DeLucia is a board-certified obstetrician and gynecologist and has been a fellow of the American College of OBGYN since 1995. She's a leading expert in female sexual health and regenerative vaginal medicine and one of the most in-demand specialists for sexual wellness treatments. Dr. DeLucia is also the author of 2 best-selling books, Ultimate Intimacy, The Revolutionary Science of Female Sexual Health, and Ultimate Connection, The Blueprint to Everlasting Love Inside Yourself. She's also contributed a chapter to Tony Robbins' new book, Life Force, How New Breakthroughs in Precision Medicine Can Transform the Quality of Your Life and Those You Love. She lectures all over the world, and I am thrilled she's here. As you'll see, this is a woman who genuinely cares about her patients, and she is supremely fun. Here is Dr. Carolyn DeLucia.
I am honored to be here. And I want to say, first of all, thank you for having me. It's incredible to have this platform to share what we're both trying to do for women.
Absolutely. But what I love about you is you bring an extra vagina when you travel. And anyone who says, look what I brought you, and it's a vagina, I'm like, I don't know if it's too early in our relationship to say, I love you. But
Aww, I love you too.
I really do love you for what you're doing. And I love how passionate you are about what you're doing. And so I actually kind of want to start with some anatomy.
Okay, let's do it.
Start with some anatomy.
I think it's extremely important.
Yeah.
One of my friends says, can you pick your vagina out of a lineup? And if you can't, I think you have some studying to do. So we can get a little bit clitorate, right?
Yes, we are here to increase our clitoracy. And that just means we know more about ourselves. We know more about women's sexual health. And with everything you do, which is so vast and really incredible, your whole professional journey, but what you're doing for women in terms of your non-invasive options. And we'll get into that. We're going to get into hormones. We're going to get into laser therapy for your vagina. Oh my God, I think I want it. P.S.
The prerequisite is, do you have a vagina?
Exactly.
And everyone should, once childbirth, this should be mainstay. It should be like rehab for the vagina.
Yeah. Thank you. I like that.
These things should be in place. They're not yet, but we need that.
We do need that. I mean, think about what it goes through.
Exactly.
It goes through this massive exit strategy of a human.
Exactly.
And then we're just supposed to be like, boop-a-doo, we're good? I don't think so.
No, we're never the same. Not that we would change it for anything in the world, but carrying a pregnancy, whether you have it vaginally or have that child by cesarean section, your anatomy is altered.
Yeah, it is. It is. Okay, actually, before we go to anatomy, your overall practice is all about sexual health, not just women's sexual health, but also men's sexual health.
That's right.
But I'm going to guess primarily women.
Primarily women, but if their partner is a male, if I optimize my woman, I have to make sure he can keep up, and the pun's totally intended.
Yes, absolutely.
Yeah.
So then do people come to you as couples?
They do.
Really?
Oh, yes, all the time.
And can they just come to you because they're like, hey, we think our sex life can be optimized or sex has been painful? Why are they coming to you?
All of the above.
Okay.
All of the above. Or they simply want to live longer and live better. So with that, it's a longevity type of vision. And my approach is truly about helping people live longer, live better. But in doing so, they have to be able to maintain their intimacy. There's nothing more important, I don't feel, in a human life than having important relationships. And not always sex, but sex is a big part of it. And they have to know how to connect and stay that way.
Absolutely. Because if you're not having sex in your intimate relationship, so basically in the relationship where you would have sex, have intimacy, however you describe it, or however you define it.
Correct.
If you're not, I mean, that can impact your mental health. I mean, obviously your overall quality of life.
That's right. It's a ripple effect. That's what I say. It's an absolute ripple effect. It affects your children.
Yeah.
Anybody who sees you. As your children see a couple interact in a positive fashion, they leave the house more confident.
Right.
And it has an effect on their well-being. When their parents, two women, two men, men, woman, doesn't make a difference. But when there's conflict in that relationship, the child feels that conflict.
Most definitely. And I would think not just the child, but the coworkers, the person at the store.
Absolutely.
Because however we're feeling, we're giving off those vibes.
That's correct.
So if I've just had the most epic and orgasmic night of my life, nothing is bothering me.
That is correct. I always say, when I do my talks, is that if anyone in the audience has said sex last night or few minutes ago, you got a chip on your shoulder, a hop in your step. I don't care. It feels good.
It feels good.
And that's part of being human. It's not a negative. It shouldn't be taboo. Women should be willing and able to enjoy intimacy.
Yes.
And faking it only cuts off your nose to spite your face. He's going to stop trying, right?
I don't get that. I
don't
really
get it either.
don't. I don't understand it. Why would someone do that? I mean, I do. Look.
Right.
You know, to be fair, I understand. It's like we want to make people feel good, or maybe you just want to get out of the room kind of a thing. But, you know, if you want to stay in the room, you want to be happy. Like, I want to finish that race. I want to finish that race so well.
Exactly.
You know, and then continue to finish the race 5 more times. And have us be happy.
Yes.
Because that's the thing that brings you closer. I mean, all of the...
That connection, that look across the room, that little intimate, oh, I know what you're thinking. Yep, I'm thinking the same thing. That's fun. That's humanity.
So you get to do this for couples. You get to really be a part of their life's journey.
Yes.
How awesome is that?
It's fun.
I mean, that's really amazing. So you transitioned from OBGYN to now your whole practice is really about sexual wellness.
Yes.
And anti-aging. Would you throw that in as well?
Yes.
Okay.
I have a full med spa. I do.
Full med spa. So I can get my face lasered. I can get my pussy lasered in the same day.
That is correct.
I like it.
Yes.
I really do.
Yes.
I
and
really
your breasts plumped. So I call that the trifecta for women. Face, breast, vajayjay. And then for men, I call it the double header.
Perfect. What are we doing to them? We're lasering their faces and we're lasering their penises?
Or doing fillers, Botox.
Sure. Something to the face.
PRP,
something to this head. What are we doing to that head?
Their hair. We are enhancing their sexual function with a multitude of devices, as well as the P-shot, PRP.
Right.
Which is incredible. You want me to explain what PRP is?
I really do. I really do. Because this gets into the O-shot.
Yes. Let's go. PRP is the portion of our blood that helps us heal ourselves.
Okay.
So when we are little, we scrape our knee, yellow goo comes out, scab forms, scab falls off, nice new pink skin, no scars.
Right.
And typically, as I'm saying this, my women are in their stirrups and I can see their knees. And I'm like, look, no scars.
Yeah.
And that is PRP.
Okay.
Doctors were looking for a way to get athletes back on the field.
Right.
More quickly, more efficiently, like A-Rod, for example. And when this first happened, he had to travel all the way to Florida to get PRP for his knees.
Okay.
But what they were seeing is that scrapes were healing.
Okay.
The joints were not. And if you think about a joint, if you've ever seen those pictures of arthroscopy, it's white, it's clear, there's no blood in a joint.
Right.
So there isn't a lot of PRP, platelet-rich plasma. So they thought, can we isolate this portion of the blood? Can we concentrate it? Can we put it where we need it? Like sending in the cavalry? And the answer is yes. So just by drawing blood, like you're going for a regular blood test from your arm, and spinning it down in FDA-approved centrifuges and devices that are specifically used for returning your own body product back to you,
Right.
then we can re-inject it within 15, 20 minutes wherever we need to. And it's highly concentrated. The sweet spot is around 6 to 8 times concentration. And we can put it in joints like the orthopedists do now, or in the face, in the breast, in the penis, and in the clitoris and the vagina.
All right. So let's pause for a second here. If I'm going to get a shot, because this is a shot, when you inject it,
That's
is with
correct.
a needle.
That is
and
correct.
you're going to put that in my clitoris?
Yes.
That's got to hurt. Am I right?
No. What? We have it totally, and when I say we, it's the Cellular Medicine Association run by Dr. Charles Runnels, and I think you're going to be having him as a guest. So this is a little bit of a teaser, everybody.
Which is great, though. He's flying in from Alabama. I'm so excited. Everyone's going to fall in love with him.
Oh, no question.
Yes.
No question. And this genius invented this procedure for women and how to make it painless and seamless.
So how is it painless? How? This is a needle going anywhere.
3 different methods of numbing the clitoral area.
Okay.
We do something called a clitoral block. And that is local anesthetic injected in the area where the nerves come in.
Does that hurt?
No.
Really?
Because we use a topical as well.
Okay.
That
So
sits
first
for,
we have the topical.
Yes, the topical sits for 20 minutes.
Now we come in with the block.
That's right.
And then next
ice.
Next is ice.
Ice.
And then finally, we've
The
already
needle.
taken the blood, we've spun the blood.
Yes.
Needle comes in. How many
Yes.
times are we like putting
1 in the clitoris.
One.
1 in the G zone is what I like to call it. And we'll get into whether or not there's a G spot or not.
or whether it's more local, more a larger zone?
A larger zone or different location for different women. And
Got
the
it.
PRP will spread into wherever that is.
Okay, so I think this is a fantastic time to pull out the vagina. So if you could,
I would love to.
if you could fetch your vagina, that would be fantastic.
All right.
And so when you say, oh, and by the way, I'm holding the clitoris
Oh yes. And now this
Yes.
clitoris will rest.
right here.
I will show you how it rests.
I'm feeling separation anxiety
typically
already.
right like this. Does
Okay.
everyone see how it's sitting? Right under the pubic bone.
All right.
And you may hold your clitoris,
Thank
but
you.
that is where it sits and is hidden behind the vulva, the labia majora and labia minora.
Okay.
And with that, the G spot is anywhere from 1 centimeter to 4 centimeters in on the
Really?
front wall.
That close? It
Absolutely.
feels to me like it's so much farther away.
So each woman is different. 4
All right.
centimeters is about 2 inches.
Okay.
So
Yeah.
it's in there, and every woman has one.
Mm-hmm.
It's a cluster of soft tissue that rests right below the urethra, and it has an area of soft tissue, blood cells and blood vessels that will help support the urethra, which is the tube coming from the bladder.
Got it.
And with that, it has nerve and sensation. We can find it on ultrasound. We have found it on cadavers. The beauty of it is that it's an erogenous zone. What that means is some women have it as an erogenous zone. Some women don't. It's like the nape of the neck. Some women say, oh, yes, it arouses me when you kiss my neck, or ew, don't do that.
Interesting.
Right?
Okay, so everyone with female parts has one. Everybody's got a G zone.
That's correct.
And we're calling it a zone rather than a spot because it really is an area.
It's an area in the front wall, and where exactly it is per woman, it's not just one tiny area.
Right.
It's a zone.
A zone.
And that may include the O spot or the A spot, being where it's further up. An A spot is in the fornix, or further up, if you see my finger wiggling, right before the cervix. Now, the cervix itself is an erogenous zone. And there are such things as uterine orgasms. There are clitoral orgasms. There are vaginal orgasms. There's combinations of all.
Okay, let's talk about uterine orgasms. That I've not heard of.
Oh, yes.
What does that mean?
It's a unique sense of stimulation when the cervix itself is stimulated, whether with the penis or fingers or a toy. Yeah.
So you're stimulating the uterus, you're stimulating the cervix, you can have an orgasm. So not only can you have an orgasm that is vaginal.
Correct.
Or clitoral.
Correct.
But you can also have a cervical or a uterine.
As well as nipple orgasms.
You can have a full orgasm from just nipple?
Yeah.
Wow.
Yeah.
It's pretty extraordinary.
I know.
Pretty extraordinary.
Our whole body is an erogenous zone. Every person has different areas that are particularly sensitive and arousing. It's part of the fun of getting to know a partner.
Exactly. And I mean, the more you know about your anatomy, the more you can be like, oh my God, I just had a cervical orgasm.
That's right.
And if your partner knows more about your anatomy, whether they have the same anatomy or not, you probably help them be safe in terms of exploring that.
Yes.
Like, P.S., am I touching your cervix right now?
Yes.
I love that. That's so cool. So when you said that whole G zone supports, you said it supports like the pelvic floor?
The urethra.
The urethra.
Yes,
okay, so it supports the urethra.
Neck.
Does that mean that having an orgasm, like having really a G zone or G spot orgasm, vaginal orgasm, right? Same thing.
That's without any clitoral stimulation.
No clitoral stimulation.
That's
and so that is a
muscular
event?
Typically a vaginal orgasm, whether an orgasm in general ends up having the peristalsis or the pulsating of the vagina.
Right.
That is triggered by almost any of these, although the uterine can be quite unique.
Okay.
And if you can actually separate them and tease them out, it's fun.
That's amazing. Do you teach that?
I don't teach that. No.
Does anyone teach that?
I think they do.
They probably do.
Yes.
All right.
Therapists.
Right.
And Tantra specialists.
Definitely. Because I think that's pretty interesting. I mean, obviously, people can differentiate between a clitoral and a vaginal.
Yes.
But I think it would kind of take next level if you've got that down.
To tease out the
cervical and uterine.
Absolutely.
Like, I'm excited about this.
Yeah.
I feel like I'm adding things onto my to-do list, but it's the good to-do list.
It sure is.
It's the good one.
Yeah.
Okay, this is so cool. So I feel like everybody also should have a vagina on their coffee table.
Yes, of course, right?
Because when we're looking at it like this, it really is, like, what are the little ears coming off of the cervix?
Well, this is the uterus.
That's the uterus. Okay, what are these guys? Here, let me. If you could pass the vagina, that'd be great.
The fallopian tubes and the ovaries, they're inside the abdomen. And then when you look at it this side, see that side? I'll show it to our audience. You could see the pubic bone, the bladder, and the proximity of the vagina to all of that. So before we have a baby, that's how
it goes like that.
Before we have a baby, our vagina is a cylinder.
Mm-hmm.
After we have a baby, it can turn into a square with a vaginal birth.
Oh, really?
The bottom is the rectum, the top is the bladder, and the walls are laxity.
Oh, we want to come back to cylindrical form.
That is correct. So we want to take an overstressed rubber band back to a new rubber band.
Yes.
We don't really want to drastically change the diameter.
All right.
Because you don't want to narrow the vagina permanently.
No.
If it's not gaping.
Right.
Because that could be trouble down the road.
I don't like the sound of that.
You know? Yeah. So when we lose our estrogen later in life, then what happens is we lose elasticity and the ability to stretch as well as lubricate.
Got it.
Because without blood supply, which is what estrogen supports, it supports blood supply. Without blood supply, then the tissue begins to change.
Oh, I see. So we go from that wonderful, highly lubricated cylinder to a dry box.
That's correct.
Okay, so to stay in that cylindrical place, is this where I'm doing laser vaginal rejuvenation?
Yes. So let's define vaginal rejuvenation.
Okay, let's do that.
That is lingo that was brought to the market by Dr. Matlock in California, who is a wonderful genius.
Yeah.
And he was the first really to introduce, number one, the nomenclature, vaginal rejuvenation, and the surgical procedures. So in the medical world, vaginal rejuvenation is surgical. Meaning labiaplasties, making the labia minora smaller, making the labia majora either tightened or filled with fat because they lose fat as we age.
All right, understood. So that's surgical. And
that's correct.
In reading about your offerings, when you say non-invasive.
That's correct.
Non-invasive treatment.
That's right.
A non-invasive treatment would be the laser.
Yes. Energy-based devices, which include lasers. Lasers may be CO2 or erbium on the U.S. market. They're all wonderful.
Same as our face.
Yes.
Same as our face.
Exactly. It all transferred from the aesthetic world on the face into probes that can be used in the vagina.
This is amazing. So with, an erbium laser on your face, I think if it's pretty, high frequency, that you're going to need to, be like asleep or something.
Right.
Are we sleeping for the laser?
No, but it is used at a lower intensity.
Okay.
Erbium has an enormous affinity for water. We are 70% water, which is why that could potentially hurt.
Yeah.
In the vagina, especially in the lower 1/3 of the vagina, you would require numbing before erbium. CO2 has a lesser affinity for water, therefore does not need numbing.
Okay, got it. So I'm just going to go and just going to set the vagina down for a second, but I'll hold on to the clitoris.
Okay.
And so I'm going to go back to, just so I got the procedures, the options straight.
Yes.
Because this is the part that I feel can be really overwhelming for people. Just as a consumer, like I'm interested, I want something, I know that something can be done, but there's a lot of things. And when I Google it, I'm like, what?
Yes.
So that's the point of this show, is really to break these things down and go, okay, I want the O shot. That sounds right for me.
Yes.
I know what PRP is. I've got a handle on it. I'm going to look that up and find a provider near me
Yes.
and say, hey, am I a candidate?
Yes.
So with the O shot, we're using our own blood.
Yes.
We're doing 3 different kinds of numbing.
Yes.
You inject it. You said the sweet, about 6 to 8 times. So it's not like you inject it once and I'm done.
Well, you get 1 injection for local anesthetic.
Okay.
You get 1 injection into the clitoris.
Right.
And 1 into the G-spot zone.
Got it.
That's it.
And then, I need to make a second appointment with
No.
you. No, that's a one thing?
It's when done correctly, it's once a year.
It's not a series.
It's not a series.
Oh, I like that.
Yeah.
I do. I like things that can be done in just like,
exactly. Once a year.
Once a year. Oh, this is so good.
Mm-hmm.
Okay, so this feels like it's pretty quick. Is there anybody that cannot have the O shot? Are there, I have had, let's say, some disease or something. Can I not have it?
Right. So contraindications are women who have active infection, obviously.
Sure.
Pregnancy, we just don't do it.
No, obviously.
And women who have a disease that affects their platelet function.
Okay, understood.
Anybody who has a platelet disorder of some kind is not a candidate. It's not worth their money. It probably won't work.
And that sounds like it would be something that would be rare and something that you would identify upon like an intake.
Of course.
Okay. You go through all of that.
Right.
What I'm right for, what I'm not right for.
That's correct. And now let's also say what an O shot does.
Yes.
It's for sensation. Its key usage is for arousal and orgasm. That's why it's called the O shot, but we like to also call it the orchid shot. But what we are referring to is increased blood flow and nerve to the entire clitoral area. When we inject
show us where you're putting the injection.
Now, this area right here is just that little pink tip that we can see.
Yeah.
The rest of the clitoris is hidden, but will fill with the PRP. So we put the PRP in an area in the little pink tip that we can see. And in certain cases, and when I had my first shot done by Dr. Charles Runnels himself, I felt that PRP shoot right down both sides.
Wow.
And I have had 7 subsequently.
Wow.
1 a year because I will not live without my O shot.
Oh, I love this.
I like the chandelier.
I love that.
Absolutely.
Oh
the
my
intensity.
God.
Now, I will also say that going through menopause when I was 53, I lost all sensation in my clitoris. I was a normal orgasmic woman. My record had been 15 multiples, and all of a sudden rubbing my forehead felt more sensation
No.
And I said, this is not that. So that's how I found Charles.
Really?
Yes.
And Charles is
Dr. Runnels, who invented the O shot.
Yes.
Yes.
The gentleman from Alabama.
Wonderful genius.
So
Wonderful
excited.
Genius. Yes.
And such a gentle soul.
Incredible.
All right. So this starts happening to you.
Yes.
And you are like, oh my God, no.
This is not going well at all. And then the vaginal dryness, and I had only had cesarean sections, which does weaken the front wall of my vagina. The rest of it, no, not stretched. Therefore, penetration was agonizing. Felt like the round hairbrush. I was blowing my hair dry.
Oh.
I'm like, honey, why are you using the hairbrush? Where's that other thing we used to use? Put down my chi.
Oh my God.
It was horrible. And 52, 53, I said, this is absolutely not okay.
So why would that pain happen? Why would that feel like a hairbrush?
Because of the lack of the blood supply, because I had no more estrogen, and lost all lubrication as well as elasticity.
Wow.
So women experience this on a regular basis, suffer in silence. They will pretend to be asleep, turn away from their partner. Heartbreaking.
Yeah.
Heartbreaking. I hear this every day. Women say, oh, we don't do that anymore. And my next question is, would you like to? Because if they would like to resume that activity, there are many solutions. One, PRP for sensation, bring back your ability to have an orgasm by injecting it at the G spot, which is that small area on the inside of the vagina. They will regain that sensation. In addition to, it will help blood supply to the area.
Which is less hairbrush effect.
That's correct. So a little bit more lubrication to really push that lubrication over the edge non-hormonally, and we could get into hormones shortly.
We are getting into hormones.
Is the laser and or radio frequency.
All right, let's go laser first.
Yes.
Since we already talked about, we touched on it, and that would be more for let's bring the vagina back to the cylindrical form as well.
Correct.
So less square, more cylinder.
That's right.
Okay, so if I come in.
And more cling.
And more cling.
Cling for sensation for both you and your partner.
Cling.
Cling to what's penetrating.
Got it. Oh, almost like suction a bit?
Mm-hmm. Right.
Okay. Yeah.
Right.
Yes.
We should have that.
I feel like that's more like it's more like having an active partner rather than a passive object.
Yes.
Okay. Got it. All right. So I'm coming in for laser and I'm like, we've done my intake and you're like, great. You know, you've had
normal
2 kids.
No HPV.
Normal, all of that. You're a candidate. Let's do this.
Yes.
Now I come into your office. Am I numbing?
Nope.
What's the experience?
I use CO2
all right.
versus erbium. There's no need for numbing.
Okay.
Post-procedure, there is 3-day downtime of no penetrating intercourse.
Got it.
However, other than that, there are really no restrictions whatsoever in activity, and it's painless. So the vaginal probe that I use is hygienic sheath that's individual to you.
Okay.
And it's a clear plastic, very comfortable object.
Does it look like a curling iron?
Yeah,
we're talking about
a little bit. Yes,
okay,
but it doesn't open. So
you're holding
or
something
close.
that's like this. That's about curling iron size.
That's correct. And we put it into the deepest portion of the vagina.
All right.
So let's say this is the probe, and then I would fire it and turn it, fire it and turn it, fire it and turn it.
2 to 3 inches.
360 degrees.
2 to 3 inches ish.
It depends on the vagina.
Okay. All right.
Some women, if they've had 4 children, I could go up to 4 inches.
I see.
And I will then exteriorize 1 centimeter at a time, half an inch at a time, and fire 360 degrees all the way out.
How long does this take? How long are you doing
5
this?
5 minutes.
5 minutes?
Max.
That's it?
Yes.
And no numbing, no anything?
No. Nope.
How many times do I have to do this?
Once a month for 3 visits, and maintenance on average is once a year.
I want it.
It's wonderful.
I do. Is this the FemiLift?
Yes.
I like it. I like the name too.
Yeah.
FemiLift. All right. So FemiLift is the CO2.
Yes, my CO2. There are
Your
others
CO2.
on the market, to be fair.
But you like the FemiLift.
I do. It has 3 patents on it that still set it apart from the others.
Oh, I see. Okay. So I could ask if I'm not in New York, where you're based.
Oh, yes.
Then, or New York area, tri-state area, I can, Google around and then I find a provider and I'm like, do you have the FemiLift?
Correct.
And they might not have that brand, but they might have another, but you like the FemiLift the best.
I do.
Okay. Well, I would trust that. And then I'd ask for FemiLift is what I do.
Yes.
All right. That sounds amazing. Once a month, 3 months. And then I'm going to get more blood flow, more lubrication.
That's correct. Oh, my, I no longer felt the hairbrush.
Wow.
It was fantastic. It reminded me all of a sudden, being active, like, oh, I'm lubricating I remember he must be doing something right. This feels familiar. And you don't even realize how much had changed till you get it back.
Yeah. Wow.
Yeah.
Totally.
Yes.
Like you don't know what you've got until it's gone.
Yes.
But then it comes back and you're like, thank God you're back.
That's right.
I missed you.
That's correct.
Okay. So we got the PRP. We've got the FemiLift, which is the laser. Let's go to hormones.
Okay.
Because like you said, if you lose the estrogen, then you're not getting what creates the moisture.
That's correct.
And so that's no good.
No.
So I could be low in estrogen, but couldn't I also be low in testosterone, as I personally was?
Indeed.
And progesterone?
Indeed. So
you
our
test our
ovaries,
levels?
absolutely. Ovaries make all three: estrogen, progesterone, and testosterone. And the biggest crime is how testosterone is not viewed as necessary for women. It's extremely necessary for women and for longevity.
I agree with that. I definitely do.
Yes. Mental acuity, quality of sleep, ability to build muscle, lose fat, stay with a libido, and as well as sensation to the clitoris.
How about also like motivation? Just overall like motivation in life.
Exactly. Energy.
Yeah. That's how I knew I was missing mine. I was like, what happened to like my killer edge?
Yes.
Like, why am I just like, I don't know, should I rearrange this drawer? You know what I mean? I mean, I was like, what's going on? And then I was like, should I take a nap? And I'm like, I don't take naps.
Yes.
So that was like no good at all.
No.
I did the pellets.
I love them.
And it was
life-changing.
Life-changing. All right. So you do the pellets too.
I do.
And the pellets are just testosterone, correct?
No.
Oh.
No.
Tell me more.
So testosterone I do prefer testosterone in pellet form for women. I like it for men as well.
Okay.
Men, it's twice a year. Twice a year, they get their pellets. They don't have to worry about giving themselves injections, and it optimizes their level. All of these procedures are tailored to the individual. We follow lab work, your weight, your age, your desires of what you care to feel like, because that plays a role too.
Okay.
But women and men need testosterone. Men need estrogen. Women need testosterone, estrogen, and progesterone. Estrogen works as a rotor-rooter for our blood vessels.
Ooh, I like that.
It keeps the plaque away. So before menopause, it's not very common for women to have cardiovascular disease.
Right.
The reason is because we have estrogen cleaning out our blood vessels. And once we lose our estrogen, we will rapidly begin to build plaque.
Ooh.
So
we don't want that.
We do not want that. And if we are building plaque and you wait longer than 10 years seems to be the marker, and we introduce estrogen at that point, it'll start to make that plaque flick away in pieces and could increase cardiovascular risk. That's what the Women's Health Initiative showed. Because in that study, which came out in 2002, one time when my phone rang off the hook, beyond belief, I'll never forget that day. It was because the Women's Health Initiative said estrogen was dangerous and would increase cardiovascular risk.
And wasn't that when everyone
went off,
gave a horrible name to hormone replacement therapy in general? Because I will tell you, when I first asked my OBGYN on a regular routine, and I said, I'm tired, beyond regular tired.
Yes.
And, my risk factors for depression are X, and I don't feel like myself. I don't feel like myself. Here's all the things that are happening. And I said, so I'm really interested in learning more about hormone replacement therapy. And you would have thought I just asked her for an illegal substance.
I believe
Because her answer, and she's a very good doctor, but her answer was, we don't do that here.
I know.
And I said, oh, okay, well, who does? And this is a, very large organization in Los Angeles. And I said, who does? And she said, we used to have one lady, but she moved to Florida. And I was like, okay, is there anyone else? And so it made me feel like this was something I needed to find in a dark alley.
Isn't that crazy?
And that seems not right.
No.
Because if you take all of our ails, right? Our ills, our ails,
That's
and
right.
you just go, oh, here's another antidepressant. Oh,
Yes.
you're depressed. Oh, you're just depressed. You're not really following proper medical protocol in terms of what
The cause.
Yeah. in terms of the cause. So, and that might not do anything at all, except for
make you numb.
Yes. And that's the opposite of what we want.
That's correct.
For men, obviously, there are all of these normalized, oh, sure, talk to your doctor about,
That's
no
right.
problem. And yet, for women, it's different. And this is what I want to change. And I'm sure you want to change
Desperately.
as well.
Yes. Yes.
So hormone options, if I come to your office and we run my labs and you're like, okay, you're low in testosterone, you're low in progesterone, you're low in estrogen too. Are you giving me creams? Are you giving me pellets? Are you giving me, how do you determine what kind of potions you're giving me? And
all right.
What do they look like?
So many aspects come into that decision because I said this is tailored to the individual.
Yeah.
It will depend on if you have insurance that you want to cover your medications, or if you have money that you want to spend on your longevity and you were willing to pay out of pocket for compounded bioidentical hormone therapy.
Are they expensive?
They can be. They're not outrageous. They're not outrageous.
Okay.
It's probably in the ballpark of $70 to $100 a month.
Oh, okay.
That's in the ballpark of what they will cost.
Okay.
Whether you're getting them in any form, whether it's a sublingual, fast burst, I call them.
I like
They dissolve under the tongue, and it is daily, but it's a great place to start for someone who's just getting into bioidentical hormone therapy.
Got it.
Creams are not my favorite for a number of reasons. They are the most widely available. However, they will vary compounding pharmacy to compounding pharmacy.
Got it.
It's somewhat difficult to mix them and keep them mixed once they're delivered to the patient.
Okay.
Because they're in, if you get a face cream, that's a cream, and you put it on the counter and you let it sit, you will have it separate somewhat. So will your hormones.
Got it.
And then they are not evenly distributed in that cream. And on days, some days you're going to get a big boost of hormone, and other days you may not get so much. So it's not my favorite because it's not consistent. I appreciate having been a routine OBGYN like your doctor and living through Women's Health Initiative in 2002 and having that fear and respect for hormones.
Right.
Because we didn't quite understand the results of the study. It threw us.
Yeah.
And with that understanding, I don't like ups and downs of our hormones, jigger-jaggered, never knowing what you're getting.
No.
I like it to be even and consistent delivery, which is what pellets will do.
Okay, got it.
Pellets come estrogen and testosterone. And we can mix and match dosages in the pellets to mainly hit what you need as an individual.
Okay, and when we say pellets, how big are these pellets?
I would say, some people say, I say Tic Tac.
Oh, you do?
I do.
Okay.
Because I think they're a little bigger than a grain of rice sometimes.
All right.
So it depends on the dosing.
Yeah.
But a Tic Tac is a reasonable explanation. And that is exactly the analogy I use.
And then to insert them, do you have to make an incision and like make a little hole, like make a little purse?
Yes, we do. For men, it's 5 millimeters. So that is a quarter of an inch.
That sounds very
quarter
small.
of an inch. And for us, it's 3 millimeters.
Oh, that's tiny.
Oh, it's tiny.
So I'm not going to get a scar.
No. And if I were wearing slacks, I would show you all my scars because I pellet myself on my hip. I do. And I put them in the direction towards my hip and towards my buttocks, which is where it's generally placed starting from the center toward the outer portion for other women.
Okay.
But being that I'm doing it for myself, I have all my little notches in the same place, right where my bathing suit band is. I may need a wider one as time goes. But that being said, that's where all my notches are, and they fade. So there's all levels of maturity.
I like it. And it's also kind of like having like little battle scars. Like, look at how many pellets I've ingested.
That's right.
Like, check it out.
7 years of, I think I'm going
7
on
years.
8.
Wow.
8 years of pellet therapy. Yeah.
All right. So I come in, you could possibly give me pellets.
Yes.
You might give me creams, but it's not your favorite.
Right.
Could be sublingual.
That's right.
Could be a combination of all.
That's right.
Could be a pill.
Yes, it could be a pill, progesterone.
Okay.
Progesterone, we like oral progesterone. So
All right.
if you have a uterus or if you're having symptoms of low progesterone, such as anxiety or not able to sleep as well through the night, progesterone is extremely calming. And we like to give it orally in our world of bioidentical hormone therapy because it gets absorbed best that way.
Got it. Okay. So I'll probably take it at night in a capsule. And is
Correct.
that something that you would prescribe just as a regular doctor would prescribe an antibiotic and I'd go pick it up at CVS?
Yes.
But CVS doesn't fill it because it's bioidentical, or do they?
They do.
Oh, they do?
They do.
Oh, okay.
Bioidentical progesterone exists at the general pharmacy.
Okay. But it's going to be my formulation, right? That you've designated. It's
Dosage.
not like buying, like Altoids where it's like, it's all the same.
Well, it comes in doses. 50 milligrams, 100, 200. And if you wanted to get your progesterone compounded from the compounded pharmacy, we could do that too. Oh. And they could come as troches, we call them, which are little gel-like compound that goes again under the tongue.
Why do we call them troches?
They're gel versus a sublingual fast burst.
All right.
So sublingual fast burst can look like a little tablet that dissolves versus a little gelatin, little square.
Okay. All right.
Could also look like a small Altoid. It could as well. So it depends on the pharmacy how they make them.
Got it. Okay. All this stuff is so fun. Like, it really feels like it's a fun experience to come to your office. So far, nothing hurts.
Right.
And I'm getting better orgasms.
Yes.
My vagina is going from box shape, if I've had kids, to more of a cylinder shape. And it's becoming like this, like, lovely, hydrated environment.
Correct.
And then I can also...
Feels youthful again.
Youthful again. Yeah. Which is not like it's not good to be older, but we want things to feel good.
Yes.
And, because it's kind of like miles on a car, things, we've got to do this kind of maintenance.
That's right. That's right. We do it for our face. We should do it.
Do it for our pussies. That's what I say. Take care of your pussy.
I think at that moment, I'm going to have a drink.
I am too.
From my huge pussy cup.
Too. I mean, all
I
right.
love it.
So what would you say is like the most fun thing you do? Like, what's like, if you could design a perfect day, are you like, I've got 5 femilifts and then I've got, I'm going to put in my own pellets.
I do love that.
Okay.
I love it better in 5 to 10 days when everything kicks in.
Oh, all right.
And I get that really nice little high from my pellet insertion. However, it's not about me. And I really get a lot more pleasure out of changing other people's lives.
Yeah.
So whatever it takes to bring back that active and willing participation in a couple and seeing their lives change, seeing them come back so happy and so excited and spreading the word, that means everything.
That would be very satisfying.
Yeah, that's what I do. That's why I do what I do.
Yeah, it's pretty incredible.
Yeah.
And you're big on research. I know that you're part of, research studies for things, whether it's the FemiLift.
Correct.
Or, which we have not talked about, and I did it yesterday, the Emcella.
Oh, the Emcella. The Emcella chair is phenomenal.
I love it.
That is high intensity focused electromagnetic energy.
Yep.
Another energy-based device.
I love it.
It's miraculous. And truly, there is no prerequisite to use that except do you have a pelvis? You can be male or female. I say that it should be at every airport gate. It should be Apple Pay or something where someone can just sit down while they're waiting for their plane. Instead of those massage chairs,
Thank you.
have your pelvis retrained.
Absolutely. That is what I'm seeing. I'm like,
Right?
let's put this as,
Everywhere.
let's put them at, as board chairs.
Yes.
Let's
yes.
put them
It's what
at
it-
bus stops.
Oh, absolutely. Absolutely. Everywhere.
It was fun. It was really, really, really fun. I had such a good time.
Mm-hmm.
I mean, it was an interesting sensation,
Yes.
but not painful.
No.
Not painful at all. Like interesting. And I already feel a difference today.
Yes. Yes. And
It's so cool.
that's because you are young and healthy. Sometimes what women must understand, this is the first non-invasive device approved by the FDA for the treatment of urinary incontinence in men and women.
Okay.
And what it does is it retrains the entire pelvic floor musculature.
Where there's so many muscles.
That's
Yes,
correct.
Right? There's
And,
so many.
That's right. There are many, many, many. And
It's like a whole
every
network.
single, that's correct. It's the cradle of civilization, I call it, our pelvic floor musculature.
I love it.
It's where it all begins. And it has to be maintained and
Yes.
respected.
Yes, it does.
Yes.
It does.
Yes. And these devices, anything with high fem technology, will cause 100% of the muscle fibers to contract.
High fem is
High intensity focused electromagnetic energy. It is a Tesla magnet. It is a 2.5. That's what you were sitting on.
not a laser.
It is not a laser.
Not a laser.
It is a 2.5 Tesla magnet that causes a rattle, as you felt, of the positive and negative electrodes in your muscles,
Right.
and triggers them like dominoes to contract.
Yeah.
100%. So for 100 years, almost, I've been telling women to Kegel, right?
Yep.
No one does it right. No one does it enough. I tell women, do 100 a day. I confess, I have never done 100 in a day.
Yeah.
I start out with great intentions,
Don't we all?
but never happens.
Yeah.
So this chair takes that away. Not only does it take it away, it makes it super maximal.
Yeah.
Meaning stronger than your body could ever do on its own.
Right. I mean, it's not like 10x.
No.
It's not even 100x. It's
Right.
much more than that.
That's correct.
Yeah.
So when we pick up a weight, if I lift a little dumbbell of 5 pounds, I'm firing 40 to 60% of my muscle.
Yeah.
Why? Because the message has to go to my brain, come back, make that muscle contract. But high fem, wherever it is used, because there are now extrapolated applicators that will do your arms, will do your flanks, will do your abs, stops the avalanche. So it treats the glutes.
Did you just call it the avalanche?
That is correct.
I have never heard that, and now I want it on a T-shirt. Possibly a mug that says, "Watch out for the avalanche." I mean,
Because it's coming.
It's coming. And you're not going to see it because that shit's behind you. Sorry, because it's behind you. I am keeping this podcast very on the up and up. But avalanche is really fantastic. Did
Yes.
you coin that term?
I did.
Yeah, I mean, own that, please. That is now going to be, I think part of your bio. She's this,
Yep.
she's this. She has done all of these. She's an luminary in the field. And she's also the coiner of the term avalanche. And I think we can all thank her for that. Watch out for the avalanche. What do you do for the avalanche?
High fem technology will rebuild
scared
the
of it.
gluteal muscles. Oh, I know.
All right, so
It
this is the
truly
same thing as
something
the
to fear.
M-Cella and then, or the
Yes.
M-Sculpt, which also I did yesterday because of the whole Cortiflor.
Correct.
So that was where they took
Yes.
this big
Applicator.
Yeah, applicator, almost
Paddle.
like a paddle. Yes, a paddle that was, I'm going to go with, I don't know, like 10 inches by 6 inches-ish.
stuck it on me,
Correct.
and then it pulled all these muscles.
Forced you to do a crunch.
Like,
Super maximal.
I'm going to say not just a crunch.
Nope. Super
Because-
maximal. Every single muscle in your abdomen.
It was insane.
Yes.
And then I could feel it with the pelvic floor at the end.
That's right.
It was truly amazing. This was at Dr. Halas's office.
Yes.
Where I love her
So
whole
much
staff.
fun.
And
Yeah.
I feel like I want to make it like my East Coast headquarters, along with you, along with your place. Yes. Yeah, I office there. It was awesome.
Yes.
It was really awesome. So I did it here on the
Yes.
right quarter floor, but I didn't know that we could avoid the ass lunge this way too.
Yes.
So I would flip it on
Yes.
over, and do we put 2 paddles on my
Yes.
butt? Oh, I need this too.
Yes.
Okay.
And 15% of each muscle will increase. 50% increase in the
50?
15.
15.
But times 3, because you have
we're at
maximum, medius, and minimus.
Oh, that's all the gluteus.
Yes.
Those are all the
Those
the
are the
gluteus
gluteus
sisters.
muscles. Yes. Yes.
Maximus, medius,
Minimus and medius.
all
Yeah.
right.
All like,
big, medium,
Yep.
small.
yeah.
Like it. All right. So
Yes.
fun.
Yes.
All right.
So all of those,
Yeah.
100% will contract,
Yeah.
and up to 20,000 times in that half hour.
20,000?
20,000. With a half hour treatment, you did 20,000 crunches of
my God.
100%. So let me tell you, I don't know if Yael told you, Dr. Halas was one of the locations that did the original studies on M-Sculpt. There were 6 or 7 plastic surgeons across the nation who are not allowed to speak to each other,
Yeah.
who had the device and were using it on their clients,
Yep.
but they had to have a way of measuring
Oh.
the muscle and the fat
Okay.
and the change. So it was measured by CAT scan, MRI,
Ooh,
and
really?
ultrasound, depending on the clinic.
How interesting.
Fascinating. Fascinating. And the end result across the board and consistent numbers.
Yeah.
And mind you, they weren't allowed to chit chat,
Right.
the docs. So at 3 months, what they saw was a 23% reduction in fat, which is equal to other
23?
devices on the market that use cold.
Yes. Got it. Uh-huh.
And then there was a 19% increase in muscle mass.
19%.
That's incredible. It's not easy to do at all.
No, it does not sound easy. It sounds difficult.
Correct.
And I want a device to do it for me.
That's right. Well, it was huge during COVID when gyms were closed
Yes.
because we could put on the device
Yeah.
and allow the patient to sit in the room with their mask on alone. I could leave with a little buzzer if they needed me.
Got it. Love it.
And they didn't lose their muscle mass because gyms were
Closed.
closed.
I love this.
Yeah.
Oh my God.
And it's great for older people. There's something called sarcopenia. Sarcopenia is something we should genuinely fear. Sarcopenia is the loss of muscle mass that happens with age, inadvertently, even if you're kind of trying to be active. It's the number 1 cause of nursing home admissions.
Really?
Sarcopenia.
And that's like, oh, I fell.
That's correct, because if you don't have your muscle mass to hold you upright
Yeah.
and you have a fall and you cannot perform your activities of daily living,
Yeah.
nursing home admission.
All right. So let's say I've got an injury in my hip. And so I can't normally do, let's say my regular activity
That's right.
is doing the Stairmaster.
Yes.
Then I could do the M-Sculpt
That is
instead.
correct.
And it's my muscles are going to be stimulated. Okay.
Way better than you could with exercise in and of itself.
Okay.
And what they also found
Yeah.
on clinical trial
Yeah.
with these devices is they did human and animal biopsies that proved the loss of fat,
Okay.
which is called apoptosis. There was a natural cell death that occurred from overtaxing the overlying fat because of the hyperactivity of that muscle.
Right.
But the ingenious factor of the technology is that it has different patterns of contractility. If you recall yesterday, there was a pattern that went bunk, 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 bunk.
I do.
That pattern flushed out your lactic acid, which is why you are not sore today.
I wondered that. I wondered.
If I did 20,000 crunches, how would I be standing straight and breathing?
I know.
Right.
Yeah.
Because of their ingenious technology that flushed out the lactic acid.
Oh my God, they are genius.
Oh, yes.
I love how all of these technologies are improving our quality of life.
Correct.
And I want everyone to know about them.
Absolutely.
Because
as they should.
It feels like they are readily accessible.
That's correct.
I mean, they are at your office.
Yes.
They are with Dr. Halas.
Oh, yes.
And if they are painless. And they don't
efficacious.
Efficacious.
Yes.
And they don't have, what's the side effects? What's the downside? It doesn't feel like any of these things have downsides to them. Am I correct in that?
That is correct. That is correct.
I mean, how often can you say that?
Exactly. The only contraindication, there are always contraindications.
Of course.
Pacemakers, because these are electrical.
So you
positive,
can't have
negative,
metal in your body?
Or metal in your body.
Okay.
Even a copper IUD. They're rare, but they exist. Most women, if they have an IUD, it's hormonal.
Yep.
But if you're using a non-hormonal copper IUD, you don't want to make it shake, rattle, and roll inside you.
Okay, something I do want to talk about is exosomes.
Okay.
Because they just sound amazing. Like I'm a little bit obsessed with them.
It's amazing.
I've already personified them.
Okay.
Like I want to, give them names. I see them walking around with little briefcases because I believe they are messengers for RNA. Is that correct?
That's correct.
Okay.
So,
because you taught me that.
Let me just say, you're a very quick study.
Thank you.
But when it comes to exosomes, they are little vesicles.
Yeah.
Non-cellular. They don't have a nucleus that come off of stem cells. And the beauty of exosomes versus PRP is that it can be an allograft, meaning it can come from somebody else and be used in you.
I see. So I can have somebody else's exosomes,
That's right.
let's say, injected into my head for hair
growth.
restoration.
Correct.
Okay.
Now, directly injecting them in the United States is not yet legal. The FDA kind of put a stall on the progress only because and justifiably people get a little crazy out there and not everyone is following the science and the safety and the purity of what is necessary in order to do these things. So with that, there are some restrictions with the use of exosomes. Right now, they're on the market for topical use.
All right.
So what that means is if you have some microneedling and you drip it on top of a microneedling, which can make little tiny microscopic breaks in the skin, and you drip it on top, but it is not injected, it can be used to help your body create new proteins. Ooh. These little vesicles carry messenger RNA. And if we recall, the vaccines for COVID, they were messenger RNA vaccines. What happens when we have a messenger RNA in a small vesicle? It can be absorbed, taken into a cell, and it triggers that cell, much like a dress pattern, to make a protein. Make the stress, make the stress, make the stress over and over again. And that protein is created and can then build new collagen in the face, new hair follicles on the head, or activate the dormant follicles. Wake them up a little, shake them up.
So since it's not approved for injecting, but it could be, this is something that's really kind of on the cutting edge, it sounds like, where we will hopefully see more exosomes used more widely in different applications. And it's going to be a liquid, right? So if we're dropping it on the face, that's like a liquid, like a serum.
That's correct.
And we can also put that on the clitoris?
We can. And you can use it on the vulva. So when we age, which is better than the alternative.
Absolutely.
Correct.
It is a privilege to age.
It is a privilege.
Yeah.
But let's respect it.
But let's make it awesome.
Absolutely.
Yeah.
Without a question. So with that being said, we lose fat in our labia majora.
Okay.
And it shifts to the mons pubis. So
the part in front.
The outer lips, thin. Mm-hmm. The skin kind of atrophies and hangs.
And these are our lips, right? These are our lips.
Right.
Okay. And the mons pubis is like the mound.
Fatty, correct. The fatty portion above.
So that gets skinnier.
The mond gets heavier.
Oh.
The labia deflate and can hang like a used softball glove that we have on the bottom of our closet, right?
Okay. So it's such a lovely image.
Such a lovely.
It's really, please describe your labia.
So how do we revive?
Hold on. Let me go see what's on the floor of my closet. I'll be right back. Well, you said like choosing, picking your vagina. Picking your vagina out of a lineup. Oh, yeah. That one, the one that looks like the baseball glove? Yes, that one right there.
Yeah.
No, we don't. Well, and we know what? If that's what you love, that's what you love.
That's right.
But if it's causing pain or if it's not aesthetically pleasing to you, then you can change that.
Yes.
Can we change that without surgery?
Yes.
Okay.
Yes.
All right.
And with exosomes. So using something that will create porulation, which is a separation of the cells just by sound wave. You can actually make a separation and free up the grout between our skin cells.
What?
Yes.
With sound waves?
Yes. So there's a product on the market called TED, T-E-D.
Okay.
This is a device, same company that makes FemiLift. They also make TED. TED uses sound wave to break up the space between the cells, and you can put any product on the skin for up to 24 hours and it will go through as if you used needles.
Oh my God.
Yes.
Okay, that's incredible.
It is. That's porulation.
So TED is not a laser.
Not a laser. Painless. Feels like a hot stone massage.
What's being put on me?
It looks like a nail, really. It's a tiny little vibrating nail, and we rub it on the forehead or the labia.
And it's separating the cells I can take in, let's say, more exosomes.
Right. That is correct.
Ooh, or even PRP?
Anything.
Oh, I love this.
And they also make a special product for hair growth that is applied with all the vitamins and appropriate product to make the hair regrow.
I would love that. So if I want thicker hair.
Correct. And as we age, we lose, yes, even women will get, and I'm covering it up with where the hair falls.
Your hair is beautiful.
Thank you.
And amazing.
Thank you.
I mean, for people who are just listening, her hair is gorgeous.
Aw, thank you.
I mean, come on.
Well, we got to take care of it like the rest of it. My father always said, your hair is your crown and glory. And my mother always said, a pair of shoes will make or break an outfit. So head to toe, got to pay attention.
Parents.
Weren't they cute?
Yeah, that is so cute.
Yeah.
Well, I would like that. I would. So on my list, I want the hair,
yes,
just more plentiful, more bountiful.
Yes. Yes.
More lustrous.
Then there's one more technology I got to squeeze in.
Let's go.
It's called Duo.
Oh my God. Hold on. Yes. I wanted to memorize this.
Okay.
But I almost just stabbed myself.
Oh no.
Okay. So hold on, because I'm dying to say this.
Okay.
I am so excited to say this. Focus, low intensity, extracorporeal shockwave therapy.
That's it.
Oh my God, I love that description.
That's what it is.
Okay. So what does that mean?
That means that held externally up against the body.
Yeah.
And if we're talking about a vulva, which is the external labia, we hold it up against the tissue here, not moving it.
All right.
So it's not weird. And we hold it here, just holding it.
Okay.
And the other spot I chose for this therapy is above the clitoral hood. So that's where our blood supply and innervation to the clitoris originates.
Okay.
Right from underneath the pubic bone. So when you apply this device and hold it in these 3 locations in women, it will penetrate 13.5 centimeters and stimulate angiogenesis, which is the word that means new blood flow.
Ooh.
And it was used in Israel, using it here, and down here for something called vestibulodynia, which is painful introitus, where it's really causes excruciating pain just to touch. And those women saw improvement in that condition. So the company came to me and said, can we use this in women? It was being used in men, and it was already on the market for men.
Got it.
And it works remarkably for male erectile dysfunction.
Okay.
And again, very simply, not being moved. It doesn't have to stroke anything. It's completely painless, requires no numbing. We hold it in 5 different locations on the male groin and penis, on the women, these 3 locations.
Okay.
Penetrating 13.5 centimeters, creating new blood flow.
How long in each area?
The entire procedure takes 12 to 15 minutes.
That's incredible.
Yep. Painless.
With no pain.
No pain. Fun. Chit-chatting. What are you doing this summer? And before you know it,
you're done.
You're done.
And it's using sound waves.
Sound wave.
I love that.
Low intensity extracorporeal shock wave. That's
I want to like take it further and have it be able to have your pussy be able to communicate with dolphins through echolocation.
We're getting there.
Can we make that happen?
We can make that. I am sure we can make it our mission.
Could you do me a favor? All right. So something we haven't covered is the fact that you're an author of 2 books.
I am. And I brought them for you.
What?
I did.
Oh my God. Oh my God. I love presents.
Aww.
Okay. I will have you know. Future guests.
Aw. This is one book. It's called Ultimate Connection. Love. It was actually the second in this series. The first.
May I?
Yes. Is Ultimate Intimacy. This book is my first book. It's The Revolutionary Science of Female Sexual Health.
You signed it for me.
I sure did.
Thank you so much. That means so much. I was about to ask you if you'd sign it. Oh, wow. Thank you so much.
You're welcome. They're both signed for you. And this one talks about all this technology. I wrote it for laymen so that they could read and understand that there are procedures available for us.
Yes.
We don't have to suffer in silence.
We should not have to suffer in silence at all.
Right.
All right. If I want to get this book by Dr. Carolyn DeLucia.
Yes.
Then, or this book, Ultimate Intimacy.
Yeah, they're both on Amazon. They were both bestsellers. Yeah.
Amazing.
Yeah.
Amazing. I love this.
Thank you.
I also like that it looks like I can read this.
In an hour.
In an hour?
Yeah.
Oh, I was about to say in a few hours, but I like in an hour even better.
What Amazon did, they actually put them on the list. Yeah. The category they put them in was math and science quick reads.
Oh, I love that.
Yeah, and they rocked it there. I think that my publisher wanted to put it under OBGYN, and Amazon just put it under quick reads, and it was up there for 6-8 weeks. Yeah.
I think that's very smart. So Ultimate Intimacy, the revolutionary science of female sexual health, and Ultimate Connection, the blueprint to everlasting love inside yourself.
Correct.
Okay. So if you're like me and you want to book 19 appointments tomorrow with you.
Yes.
I can go to your website, which is?
It is Carolyn DeLucia, MD.com.
Perfect. Which is CarolynDelucia. Perfect.com.
Yep.
And are you also, touting all of these things about on social media, or is your website the main place we find you?
It's the best way to find my office, et cetera, et cetera.
Perfect.
But yes, I am on social media. I am Carolyn DeLucia with a capital L on Facebook.
Great.
I am Carolyn DeLucia, MD on Instagram.
Perfect. All of this will be in the show notes. But for those of you who are listening who like just can't stand it, and you're like, I need it now. I need it now. I don't even want to look for it. There it is.
Thank you.
I really love everything you're doing. I can't thank you enough for making the time to be here.
Oh, thank you for you making the time, staying extra here in the Big Apple to see me. Thank you.
Yes, we are coming to you from New York City, which is my former home, but then always my home. And I love being back here.
Thank you.
And you're just doing incredible, incredible work. And I love the way you present it and deliver it, because it feels like you make it fun and you don't make it scary and you don't make it like something's wrong with me or anything like that. It's just, hey, here's how to make life better if you want to. And there's options. And I love that.
Thank you so much.
Yeah. Thank you so much for being here. Thank you for bringing the vagina.
Anytime.
Thank you for bringing the clitoris. Oh, and I have something for you. It is the huge pussy toe.
I love it.
And as you see, it has the correct definition of pussy, which is not weak. It is an otherworldly, orgasmic, flexible, resilient, life-giving humanity vessel.
Yay!
So
it's where it all begins.
It's where it all begins. It's where life begins.
It's where life begins.
You know, love it.
Absolutely.
Just love it and become more clitorate every single day.
Every day.
Thank you, thank you, thank you. I have to give you a hug. I'm Jacqueline Buckingham. Welcome to your most powerful chapter. Wherever you are on the pause spectrum, this is where you begin. Go to joinmeno.com and get early access. These are the answers, and we bring you the experts that have them.